Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey guys, welcome back. We're going to have another great episode here on Between the Sheets today. Today we're going to tackle a tough conversation, but one that I think is extremely important, and that's cancer and intimacy. Cancer really has a big effect on our intimate life and our relationships and all of these things, not only how we feel about ourselves, but how our partners feel towards us, how we feel towards our partners. And I have a fabulous guest on here today. I have Claire Rumore, and she is a wonderful sex educator, researcher, intimacy specialist, and she works in this environment of the meeting of cancer and sex. So welcome, Claire. So nice to have you.
Oh, it's so great to be here, Stephanie. Thank you.
Yeah, absolutely. So how did you kind of come to this crossroads of these two issues that desperately need help on both areas, but not a lot of people find that niche that you have found?
Right. So the arc of the story is an interesting one because originally I had set out to become an architect, and that's what I started my studies in and spent my entire childhood excited about doing, and even worked for architecture firms before college and all that stuff, and then got into the program, and about a year went by and I realized this is not for me. And so life takes us in unique and different directions.
Yes.
So through a series of synchronicities, I ended up going into sociology and chose as my concentration sexuality, gender, and identity. And I thought to myself, well, I'll probably be completely unemployable with this liberal arts degree when I finish, but I will have had a great time in college.
Yeah.
So that's what I studied and entered my post-college adulthood. And lo and behold, I moved to California.
Okay.
I'm originally from Alabama, but I moved to California a few years after college and then found that the world of sexuality is quite vast in California. And so I began studying Tantra. I worked for a sex toy company. I became an intimacy coach. Basically, I've used my degree every single day since moving here 20 years ago. And so
That's amazing.
life works in mysterious ways. And so
Yes.
how the cancer piece came in is that in 2022, I had my own cancer journey and was diagnosed with a combination of colon cancer and pancreatic cancer. And
Oh,
so
those
I
are
did
tough ones.
those are tough ones. And actually, my case was a very bizarre one. I was not the poster child for either of those cancers. And how that worked was, well, what my medical record says after the fact, now that I'm on the other side of all this, what my medical record says I had is actually stage 4 pancreatic cancer. So I'm a bit
Wow.
of a medical freak and a medical miracle. And
Yeah.
I'm very grateful that I am still here. And I'm here with a very specific purpose, and that is connecting the cancer and intimacy worlds. And how that came about was because my social worker during my cancer care times knew a bit about my professional background in sexuality, sort of pulled me aside one day and mentioned to me this massive gap in care in oncology that I think I wouldn't have ever noticed because I'm just so well resourced personally and professionally, in that world that it didn't impact me the same way it does a lot of people. So
Yeah.
through her diligence and vigilance, she pointed this out to me and just sort of seeded it with me, kind of gave me this
Yeah.
idea and said, if you were to ever take this on, the need is so huge, you'll basically never run out of work. And so I said, let me get better. But then once I'm better, I will dive into this.
Yeah.
So I
That's
came out the other
amazing.
side. And for the past 2 years, We are now, what, 2026? So I think I started formally investigating this in 2024 and then developed my business in 2025 and launched in 2026 with the aim of bridging these worlds and
Yeah.
having these conversations.
That's amazing. Well, first of all, I'm so glad you're here. You do not hear stage 4 pancreatic cancer and a patient still living. So I'm very grateful that you are still here and that you have found this passion because it really is such a issue for so many reasons, and not just the cancer but the treatments that wreak such havoc on the body. Obviously every type of cancer is going to have different effects and things like that. In my urological world, I'm very familiar with bladder cancer and prostate
Mhm.
cancer and the issues that those can bring about in relationship to
Absolutely.
sexual health. And I have breast cancer patients that I help with their vaginal dryness and things like that as well,
Mhm.
but they're not really my big wheelhouse. And so I'm just really interested to kind of dive into this with you. Tell me more about what are some of the main cancers that either the cancer itself or the treatment is really hindering intimacy?
Gosh, great question. So the obvious ones are going to be the gynecological
Uh-huh.
cancers. So ovarian, uterus cancer, so uterine
Uh-huh.
cancer, vaginal cancer, rectum cancer, all in that area is very
Yeah.
sensitive and very prone to effects, maleffects from treatments. Of course,
Mm-hmm.
prostate cancer can have difficulties,
Yep.
maleffects from more of a body image, but also medically induced menopause is breast cancer.
Oh yeah.
With mine, interestingly, this is why I think I might not have even become aware of this gap just with my journey. I was on strong medications in my
Mm-hmm.
chemo treatments. I did not have to do radiation, and the surgery that I did have, actually 3 of them were all unplanned
Mm.
and not necessarily what one would encounter or expect on the type of cancer journey that I was on
Okay.
came about later. And so, all that to say, I lost a lot of weight because of my treatments. And that's what turned off my hormones and sent my sex drive away and dormant
Mm-hmm.
for a while was because of weight loss. And that can happen for different people for
Sure.
different reasons. So a lot of athletes can, their period might go away
Mm-hmm.
like mine did because they just dropped weight because they're fit. I was ill, but losing
Yeah.
weight and dropping body fat count can cause
Yeah.
that. But then once I gained my weight back, then my hormones turned back on, my period returned, and my sex drive came back with a vengeance. And that's something that, you don't always expect. Also, I was very well resourced. I'm with a community of friends who are very affectionate, very sex positive, very supportive, very open to deep, soulful, even existential conversations. So I had support that the types of support many people don't have.
Mm-hmm.
All that to say, my type of cancer didn't necessarily produce intimacy issues. I was not in a relationship during my cancer journey by design, very
Mm-hmm.
deliberately. So I ended with my partner right before my treatment started. I had been in a long distance relationship, so it was just needed to end in that form. Then body image was probably more of a challenge for mine because I had 3 surgeries and had
Mm.
scarring in my
Yeah.
abdomen. But for sure, we're going to see all the cancers that I just named. And then just emotionally and psychologically, pretty much any cancer. Someone with
Yeah.
tongue cancer, I recently connected with someone who's a tongue cancer survivor
Mm.
and advocate. And though her cancer was above the neck, it affected her tongue. What do we
Sure.
do with tongue? We talk. Talking,
Yep.
communicating is a huge part of intimacy in
Mm-hmm.
relationships. Also, kissing, huge part
Yep.
of intimacy in relationships. And though she's able to do those things, her ability is compromised. And obviously,
Mm-hmm.
there's self consciousness that can accompany that. So I would say every type of cancer can affect intimacy. I don't just mean sexual activity, but
Yeah.
intimacy in some way, shape, or form.
Yeah, absolutely. And then I know, for my men that have prostate cancer, radiation can be really detrimental as well. I know I have some females that have
Absolutely.
had uterine or cervical and they've had radiation in that area as well. And the
Mhm.
scarring and the tightness of that tissue and things. And it becomes really difficult to work with and help them sometimes because of the damage to the tissue. So now it's not just giving you some estrogen cream and some vaginal
Right.
moisturizer because you just need a
Not
little
that
help with your
simple.
hormones.
Yeah.
This is truly damaged tissue, it's scar
It's the
tissue, and
physiology, the physical
yes,
structure has been compromised almost in some cases beyond repair.
Yeah, absolutely. I have a very good friend of mine who unfortunately has stage 4 cervical cancer, and she has
Mm,
had multiple surgeries, multiple rounds of radiation. Unfortunately, the
mm,
cancer is back again. And it's a horrible story because she is just the most wonderful, loving person who does not deserve
mm,
any of this.
mm.
That being said, she went through an entire pelvic extravasation surgery. So she no longer has a vagina. She no longer has a rectum. She doesn't have feeling in most of that area to even try and get an orgasm through clitoral stimulation. She has
Mm,
partial clit left, if I remember correctly. But that was a huge change for her, and she's married, and it's a huge change for their relationship and how to be intimate with that. And I know she knows she's fine with me speaking about this, but they've had to like talk to sex therapists and things like
mhm.
that because that's a huge issue now. Of pardon my frankness, but two of her three holes are now not there anymore, and so it is a
Exactly.
huge
This is an
change.
issue.
It's an issue. Yeah. And so, that's just one personal example that I have of someone, but
Yeah.
these examples are out there and they're so common and the help just isn't there. So I'm so grateful for you. What are some of the things that you kind of start to help the patients with personally first? And then we'll kind of go towards the relationship side.
Sure. So let me clarify that my work is less one on one with patients, and I'll explain
Okay.
what I do offer for patients. And partly that's because there are millions of patients, millions upon
Hmm.
millions of patients worldwide struggling with cancer. And so, me working one on one or even small groups with patients, obviously, my impact is only going to be a drop
Sure.
in the bucket. And so, what I have done is create a website,
Mm.
cancerandintimacy.com, and that website is designed specifically for patients, survivors, and their partners, and a little bit with clinicians and folks in helping professions.
Yeah.
So that there are a number of educational resources, support resources, handouts, worksheets, blog articles,
Mhm.
printables, ebooks, courses, coaching in a box, all these types of things that are available so that first off, a clinician can have somewhere to send the patient today, even if that
Mhm.
clinician doesn't know the first thing about how to
Yeah.
support a patient in this realm. Doesn't matter. There's this site. And if they know about it, they can send their patient there. And so I've done what I can because the site just launched in January 2026. So it's
Yay.
quite new. And so I've crafted the resources I would have wanted and the resources as an intimacy educator that I feel are important. And so there will be many more resources developed over time going up on that site. But today, at least, it's a starting place
Okay.
for patients, survivors, the partners of patients and survivors, and even practitioners can have conversation starters.
Mm.
And so that's the piece there. Then, and my big desire, dream, and vision is to work in more of an organizational and institutional settings to train the professionals, to train clinicians, the practitioners, to train the folks who are working directly with
Mhm.
cancer patients
Okay.
so that those folks who have much more reach because there's many, many, many more of them can then positively work with their patients and also get continuing education credit in the process, become
Yeah.
certified practitioners of cancer and intimacy care and intimacy informed cancer care and other ways to be more of competent, confident, and useful resource
Yeah.
for cancer patients.
Oh, that's amazing. I love that you were concerned about that reach and how many people you can affect and finding ways to do that most effectively. So, on your website with the resources, are they articles, programs? Do you have favorite products that you recommend? What are we going to find on the website?
Yeah, so it's going to be an ever unfolding piece of art, let's say. The website is in development and it will forever be in development because this realm is has big needs and there's
Hmm.
always new information,
Yeah.
new products, new insights, new practitioners, new studies
Hmm.
coming forward. So what I have right now are several categories of resources. So the first
Okay.
ones that felt the most important are treatments because there are different types of treatments. And I'm not talking about specific drugs right now. That's less my area of
Hmm.
expertise, but I'm talking more generally like chemotherapy in general, radiation, surgery, immunotherapy, these types of things. I have an article about each of those and the possible side effects that could
Mm.
impact intimacy, and also an article about fertility, what to be mindful of as it relates to fertility. And I will say, of all the realms in sexual wellness, that's probably the one that does often get addressed by practitioners presently. So I have those articles as sort of a first offering.
Mm-hmm.
And then
Okay.
I also have categories specifically for folks in active treatment,
Okay.
folks who are in survivorship, visitors to the site who want more relationship and communication support,
Mm-hmm.
and visitors to the site who need support around body image. So a lot of
Mm.
those are free downloadables that are available right this second. And the site is presently translated or translatable into Spanish and Portuguese. And then next I'll be adding French, German, Dutch, Italian, and then going from there.
That's amazing. That's amazing. I love that you have these resources for people because I know, and again, I keep going back to prostate cancer, but that's just what I
Ooh,
deal with on a daily basis.
absolutely.
And, when I have these conversations with the guys, and sometimes they bring their partner with, sometimes they
Mhm.
don't, when we're having these conversations about potential treatments, and these are your options, and this is,
Mhm.
and we go through the different side effects, and it doesn't matter which of the treatment options you're going to choose, you're going to have side effects. It's just which
Yeah,
side effects you get based on what
exactly.
treatment. Yet, regardless of what they choose, specifically with prostate cancer, they're going to have erection issues. They're going to have orgasm issues. Whether that's for a very short period of time or a long period of time, we don't know. Some of it we're going to get back, possibly. Some of it we might not. And so it's kind of talking about all of those things. And I just think if I weren't in the wheelhouse that I'm in and in love with sexual medicine as much as I am, would I make sure that I covered those topics well enough? Or would I kind of just breeze through them and trying to put myself in other clinicians' heads, right? And my guess is a lot of clinicians breeze through this part and don't focus on it too much because, oh, well, you're alive, right? We kept you alive. That was my job. Well, yeah, but I want a quality of life. I don't just want to still be around. And sex is a huge part of our life. Intimacy is a huge part of our life. And like you said with the lady with the tongue, it's talking, it's kissing, it's all of the aspects of intimacy, not just penetration. And I just think we do such a disservice by hurrying that conversation and not really delving into it and giving all of the ins and outs of what potentially could happen with various treatments.
Exactly. So I'm very committed that exactly what you named, change. Because
Hmm.
yes, keeping someone alive when they have cancer is of the utmost importance.
Hmm.
Anything beyond that won't be possible if the person is not still here. So I understand
Correct.
why many oncologists stay in that lane and think that that's their main job, perhaps
Hmm.
their only job. Hats off. I'm still here because of that. And I'm
Yeah.
grateful. And now we look at quality of life, and that falls under psychosocial and psychosocial
Mhm.
oncology specifically. And quality of life, if you were to talk with a practitioner in that realm, actually covers many domains. Some of the most important are diet and nutrition. We need to eat,
Mhm.
movement and exercise. That gets lots of
Yep.
attention, lots of funding, lots of studies, even though in my mind, that is all very obvious. Don't know why we need to confirm that through what
Right.
is it? Uh,
Multiple research studies after research
multiple
studies.
region.
Yeah.
Exactly. Peer
Yeah.
reviewed journal articles, and
Yeah.
so and so if we look at Maslow's hierarchy of needs, if we were to use that as a tool for quality of life and we just kind of work our way up it, sexuality is not at this baseline of
Mhm.
you need this to survive or life stops becoming possible. It's a little bit higher up.
Right.
Intimacy, relationships, even though I think we could all agree like these are what make the sticking around worth it. These are what add
Mhm.
flavor and spice and enjoyment to life. And they're easy to overlook when inside of allopathic medicine, Western medicine, and
Mhm.
oncology fits under that umbrella, the focus is emergency response, saving
Mm.
lives.
Yeah.
And allopathic medicine is very good at that,
Mhm.
creating a good life, working on prevention, support,
Yes.
relational and social health, mental health, and supporting the body and all its functions. So
Mhm.
bit of a broader reach. So I'm representing more of the psychosexual side of things because, to the
Yeah.
credit of oncology, there are some trainings that are like sexual medicine, for example, that are
Mhm.
incredibly important. Yet from my very limited understanding, tend to hang out in the neighborhood of function and
Mhm.
anatomy and physiology and the mechanics of
Mhm.
the body and the body's functions, sexual functions.
Yeah, you're
We're talking
absolutely spot on.
circulation of the blood flow,
Mhm.
the different moisture, no moisture, hardness of erection or not, these types of things. It's more functional and mechanical.
Mhm.
Cool. That's a fabulous start. But in terms of the picture of sexuality, we need to bring in the mental, the emotional, the psychic, the
Mhm.
spiritual, the relational, and support people with that. And I
Yeah.
suspect you might agree with me. We in the United States are in an incredibly sex negative culture,
Oh, for sure.
incredibly sex negative. So, and also a limited in our understanding of how we define sexuality. So
Yes.
I think when a lot of doctors or folks in any type of medicine hear intimacy, where
Mhm.
the mind goes to is penetrative intercourse of
Yes.
some sort, whether that's PV, penis vagina sex, whether that's anal sex,
Mhm.
that there's more of penetrative, deep, deep
Correct.
thrusting, the more mechanical. Whereas
Yeah.
I'm a stand for us redefining and expanding what intimacy
Mhm.
means and what it is, because it's not fair to people who are not able. And this includes women
Mhm.
in menopause, men who are
Yep.
in andropause, that the behaviors of 20 somethings are not available to most people.
Right. Right.
And that should not be our standard of
Right.
what sex is or isn't. And so
Yeah.
I'm a huge stand that we redefine. Yeah.
As we're talking, I think one of the other disservices is
Mhm.
insurance company, right? One of the reasons why we don't spend the time on sexual medicine is because it's not reimbursable. There are very few codes that we can use. In fact, I just found this out from my biller that the premature ejaculation code that we use is actually a psychiatry code. And so as a urologist, I cannot use that. I have to put like orgasm dysfunction or something like that. And then I can put one underneath that why? I damn well know as a urologist what premature ejaculation is. I know how to treat it. And so there's all these other things with insurance. There is no ICD-10 code for talking to someone about cancer and intimacy. There is no ICD-10 code to talk about, your vaginal dryness from something. Yes, I can code vaginal dryness. I absolutely can code that. But, I can't code it from, a certain treatment that you had or radiation or whatever. And there are some, right? There's ED that is from radiation, that's from different. There are some
Yeah.
codes out there, but there aren't a lot. And so for you to come into an office where we accept insurance, I have to make that billable. And I
Mhm.
can't make it billable for a lot of the sexual health stuff.
Mhm.
And so then you have patients going out and seeking out providers who are cash based, who
Mhm.
are psychology based, who are outside of the medical world, which is fine. I love that. But I think that's a part of why a lot of traditional medicine providers don't even get into it. Number one, they're uncomfortable with the conversation. And number two, they can't bill for it.
Mhm. And that's the way their world is organized, and
Yeah.
I completely understand that. I think you make an incredible point that someone like me overlooks because I'm not in the billable to insurance world,
Yeah.
so I don't think of in terms of codes. But you have
Yeah.
to,
I
absolutely.
do. Yeah. And I mean, if I don't turn in good bills, then my company is not very happy with me. Now, thankfully, I'm getting out of that and I'll be opening my own clinic where I can do what I want.
Exactly. It's a different game. Exactly. And a different
Yes.
level of offerings you'll be able to provide. This is why through my
Yes.
companies, I'm coming at it through lots of different angles, subtle and overt, because of
Yeah.
this very thing. So first and foremost, cancerandintimacy.com is ready for the world. It's out in the world. It's available. And I'd say it's about 85% free resources, a gift from me to humanity. There's a few
Yeah.
purchasables on there. And eventually there will be a shop of products or a products page recommending awesome companies that are doing great work with cancer
Yeah.
sensitive types of lubricants and toys, etc. So
Yeah.
putting all that out into the world. But right now, the site is primarily free and a gift to
That's
anyone who goes
amazing.
over there. And then in terms of resources for clinics, for basically for organizations and institutions,
Mhm.
I'm focused a lot on nonprofits because that's
Mm.
also where an entry can happen for this topic and resources to get to patients is through the nonprofits. And then also through training staff at
Mhm.
cancer clinics, at hospitals, at nonprofits, so that they're not only informed, but they have at the ready, here's a handout for that. You asked me a question about this. Here's a worksheet on that. Oh, here's some
Yeah.
conversation starters about that. Here's resources. And then the one other element I'm developing, and mind you, I'm playing the long game. So all these different realms, they're all in development and will be coming online as they're able. But I'm creating an online institute for
Mm.
folks who are already in one-on-one practice, whether that's as a
Okay.
psychologist, a marriage and family therapist, even a sex therapist, because not every
Mhm.
sex therapist can speak confidently or
Absolutely.
competently about cancer. Private practice social workers, spiritual directors, so forth
Mhm.
and so on. And so I'm developing trainings for folks in helping professions and oncology adjacent professions so they can become certified practitioners and then be listed in a directory on cancerandintimacy.com.
Mm.
And so that information, support across all the different realms, psycho-emotional, psychosocial, psychosexual,
Mhm.
can get to our patients and survivors through many ways
Yes, I
and not
love
have to
that.
be vulnerable, not have to be
Yes.
vulnerable.
So when you say conversation starters, because I love this,
Yeah.
I think it is so important. A lot of times I'll tell people, hey, if you liked this episode and you want a conversation about it, send it to
Mhm.
somebody and say, hey, can we talk about this episode afterwards? I
Exactly.
love having something to give someone as a conversation starter. So tell me about your conversation starters. Are they for partners? How are you coming about this?
Right. So there's a free article on the site already that's questions to ask your doctor or your care
Okay.
team. So already there's conversation starters there. And then my big passion is obviously conversation starters for relationships
Uh-huh.
because one of the biggest make or break phenomenon with cancer is relationships can be heartily compromised when one
Hmm.
partner is going through cancer. And very few of us are taught high heart centered uh, ways to communicate in relationships. So it feels really important that these skills be made more common, let's say. So on cancerandintimacy.com in the site, I actually have a very affordable product called the Conversation Starter Pack. And in it,
Okay.
there are about 40 or 50 different prompts under different categories of questions to put on the table to start a conversation that might otherwise be difficult to
Hmm.
initiate. So that's already out in the world and available. And I'll happily provide you a discount code for your listeners so they can hop on over and get one of those at
Excellent.
a discount.
Thank you. Yeah, I think it's so important. There's a lot of things that are difficult to talk about when you're going through cancer treatments and just figuring out your goals in life and things like that, but sex is just so important and the orgasms, the way we can feel from it and how healing that is and that intimate connection with our partner, it should be written as part of the treatment plan. I
Absolutely.
mean, I can't say enough about how important it is and I can't imagine going through something to this degree. I haven't had cancer, I haven't had to go through anything. I can't imagine having gone through this and being so grateful that I'm alive,
Mhm.
and yet I can't be intimate with my partner or not in the way that we used to be in the way that we really liked, and now we have to redefine all of this, and I'm supposed to be happy about that. I mean, you can make some of it fun and trying to find new things and like you mentioned, bring in new toys or different lubes or things like that than you've used in the past to try and kind of regain some of that, but there is almost like a mourning period, I'm sure, that these patients have to go through that. Yes, you mourn different aspects of the cancer and the treatment and things maybe that you lose, but the intimacy part is huge.
Exactly. You bring up an incredible point and one that's overlooked not just in oncology, but in our culture and society. And partly because we're just so terrible about grief and
Mm.
grieving. And so, in honor of this, because I was contemplating the same things that you just named. And so, I created a resource. It's an ebook right now, but it'll at some point soon become like an e program to support people
Okay.
with this. And it's called the Erotic Grief Journal. or the
Mm,
Erotic Grief Handbook, I believe is the name of the product. And it's about exactly this, taking people through the journey to honor their erotic
mm,
grief, whether it's grief over body parts that are no longer on my body or the
mhm.
body I don't recognize because I gained weight, I lost weight.
Have an
I
ostomy
lost
bag.
ostomy bag. Exactly,
Mhm,
exactly. I don't have erections or lubrication anymore.
mm,
My relationship ended, any number of things. And all of us, cancer and no cancer, 100% of us, I suspect, who are sexually active adults have something to grieve erotically.
mhm.
And the only way for us to even be available holistically for new possibilities is to grieve the old, to grieve what's been lost, to honor the erotic grief that's part of this journey. So I've created a resource on that's available on cancerandintimacy.com specifically about that. And soon I'm going to be writing
Mhm,
some blog articles to introduce this concept because we know about grief when I lose a
mhm.
loved one or I lose a job or I lose my house or some aspect of life, but that's not sex related. But then to actually contemplate erotic grief is a whole
Yeah,
other. So I would love
yeah,
for
it is.
that part of the standard of care that we're supporting
Yeah,
erotic grief.
yeah, absolutely. It is. It's so important. And I think a lot of us probably miss that when our friends or family members are going through it because I probably am not going to go have a conversation about my mom's orgasms with her if she's going through cancer, right? But my best friend, I might.
Mhm.
And, luckily my best friend, that I told you is going through this cancer,
Yeah,
she and we both
very
worked in
close.
urology together. So
Ah,
these conversations are normal for us.
exactly, exactly,
Yeah.
exactly.
But a lot of people, they're not. And so even talking to your friends and stuff, if I know somebody that's going through a cancer treatment, my first thought is not whether or not their intimacy is disrupted.
No, no, that's way down the list of priorities in our mind just instinctively. And it's
Yeah.
easy to get into that mindset of, well, they should be happy they're alive. I guess that's good
Right.
enough. And I'm not seeing them say or do or be anything different than
Hmm.
just happy to be alive. And so that's why I'm excited to write more about erotic grief so somebody can share a blog
Hmm.
article or a Substack article or a downloadable about erotic grief with someone close to them and not have to bring up the topic. They just share the resource and let that person have a personal reflection tool to aid them in their journey.
Yeah. No, I think that's amazing. It's so important, and it's so imperative to our healing process to look at all aspects that were affected by the treatment and the cancer itself
Mhm.
instead of just kind of blocking in, like you mentioned earlier, let's talk about just the nutrition, let's talk about just your exercise, let's talk about, and kind of looking at the holistic picture and how much intimacy is involved in that. And it can be with your romantic partner, but it can be with your other friends and your family as well, that we don't have to just talk about penetration. Like you were saying earlier, there's
Absolutely.
so many levels of intimacy in our lives.
Yeah, I think what got me through my journey was having friends who were comfortable with cuddling, comfortable with massaging me when I asked for
Hmm.
massages, comfortable with bathing me when I couldn't bathe
Hmm.
myself. And I just got
Yeah.
really, really weak for a period of time. Friends who bolstered my self confidence by sharing with me how cute I looked when I shaved my hair off because I was losing so much hair. Yeah, just that kind of support. Also, friends and close ones who are up for having deep supportive conversations
Hmm.
and not bringing me their emotional heaviness or their worry about me. That was also another
Hmm.
big piece that I didn't have to do emotional labor for the people close to me because they knew how to take care of themselves. And I was
Yeah.
very fortunate in that way.
Yeah, that's a great point. I think a lot of us think we're being helpful, but we're probably actually adding to that person's
It can
burden.
be that way. Yeah.
Yeah.
The way it worked for me, and this might be a model that's helpful to other people, I designated a dear, dear friend of mine who was able to be my health advocate and kind of translate all the medical stuff to me because I couldn't understand a lot of it. My brain
Hmm.
wasn't orienting towards
Yeah.
medical language at the time. So he was my health advocate. He also became my translator and go between with friends and family
Yeah.
so that I didn't have to assure people, let people constantly know what was going on, have to answer the question, how are you doing? Because I hated
Hmm.
that question. It's like, how am I
Yeah.
doing in this moment? 5 minutes from now, an hour from now, yesterday,
Hmm.
tomorrow? This is too big a question. I don't like those questions. So I
Yeah.
trained people to ask a different, not even to ask a question, more to just let me know they were thinking about me.
Yeah.
And so having this friend be the contact person, loved ones could go to him and share their worries with him. And he
Uh-huh.
was able to do the emotional labor that I didn't have
Yeah.
to. For sure, that contributed to my healing a lot.
Yeah, I can imagine. I can imagine. That's great. It's amazing that just the presence, like when you said having a friend that would be willing to cuddle with you,
Yeah.
just having somebody there. We don't have to talk. I just need you to touch. I need touch and I
Mhm.
need comfort. And I think that's amazing. That's so beautiful.
Yeah, a couple of times I had friends come over, we just took a nap together.
Yeah.
Yeah, it was very sweet. And,
Yep.
so I was very well taken care of by my community, and I'm so grateful that they came through. It's probably a little village of about 50 people, all in
Yeah.
all, who stayed with me, cooked for me, bought groceries
Yeah.
for me, did my laundry, helped me clean my home, took me to clinic. I pride myself on being an independent, self-reliant person. That's how it was
Yeah.
before cancer, that's how it is now. And wow, was that superpower taken from me during this time. And so I had to become really good at asking for what I needed and the
Uh-huh.
humility that comes from it. So there's not a day where I don't
Yeah.
appreciate having my independence and my sovereignty. I don't take it for granted. And I also don't push myself as hard as I used
Mm.
to.
Yeah. Yeah,
Yeah.
that makes so much sense. And
Yeah.
all of that got transitioned into this
Yeah.
amazing avenue that you are making for so many other people to get the help and the resources that they need. I just love that. It's so beautiful. Claire, take a minute and tell people, the website, how they can get in touch with you, whatever you want to tell them in the next couple of minutes here.
Okay, great. There's a lot of ways that you can find me and my work online. So, the first one, if you are a cancer patient, cancer survivor, or a partner of a cancer patient or cancer survivor, is cancerandintimacy.com. So, that's the main website where these resources are live and available right now. And then the next piece, if you want to know more about me as a human and a non-cancer related professional, you can find me at Claire Rumore. And then another site that I have that is indirectly useful to cancer patients is one that I created because as I was coming back into my sexual self, I noticed that my body was different. My needs were different. I needed to move slower, softer, and be more subtle. And I coined and have been developing, the sexologist that I am at heart, have been developing this new type of sexual orientation that folks on a cancer journey might relate to. And I call it
Mhm.
being a subtle sexual. So
Mm.
this is someone who needs slower, softer, doesn't thrive with intensity,
Yeah.
really needs a longer arc, needs an emotional connection, loves even an intellectual connection. So conversations can be a type of intimacy, intimate
Mhm.
sharing. Subtle sexual is really helping redefine what sexual means. And so I've created a website dedicated to the development of this concept
Mm.
and the exploration of it for folks who resonate with it. And that's exploresubtlesexuality.com. So that's
Love
also
it.
a neat resource that's there. And then for listeners who are professionals who work with folks on a cancer journey, whether that's directly or indirectly affected by cancer, and you would like more skills in this domain, I'm developing an online school. It's called the Cancer and Intimacy Institute. So you can
Mhm.
learn more about that at cancerandintimacy.institute. So that will be coming online more and more. There's a landing page already with some information, but the institute itself will be growing and coming online more later in 2026 and beyond. And then the last
Awesome.
website for folks who are working at a cancer clinic already, who work for a nonprofit that's in cancer or cancer adjacent, who are at comprehensive cancer clinics, hospitals, etc., and would like to bring this work into that realm. There's my consulting and training company that's called Cancer Evolve. So you can find out more about that at cancerevolve.com. So you see, I'm coming at
Awesome.
it from lots of different angles.
Yes, I love that though. It's really getting all the different sides so we can all treat people
Exactly.
better. Absolutely.
Ex-
That's amazing. Claire, thank you so much for being here today and bringing this topic with us. That was amazing.
Oh, Stephanie, it's my pleasure. Thank you so much for having me.
Absolutely. Don't forget to check out reviveish.com for all your hormonal and sexual health needs here in the state of Maryland. I would be happy to serve you and your partner. And as always, go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.